Hi, everyone. It's Megan-Cox. Thanks so much for joining us. So today's talk is on colorectal cancer. We've tied it with months, so like the health months. March is colorectal cancer month. So we're going to talk a bit about colorectal cancer and really then drill into those modifiable risk factors. I know we talk about those a lot because it's what we can do, right? None of us have control over our age, our gender, these other risk factors, but what can we do to help prevent cancer in this case? So colorectal cancer, it's the second leading cause of cancer death in the United States for women and men combined. 90% survival rate if we find it and treat it early. And this is a point I'd like to hammer home as if there's one thing you leave here with today, two things. One is that we have a lot more control than we know to help lower our risk, not full control, but a lot more than we've thought in the past. The second is if we find things early, we can take care of it before it gets out of control. So please, please, please screen, do your screenings, have your family do their screenings. If we find it early, it won't be such a big deal. We can remove it and you go about living your life and have a beautiful, long, healthy life. If we don't find it early enough, unfortunately, we don't have nearly as good of an outcome. 1 in 3 of American adults are not screened as recommended. So that's huge. So that's almost about 33% of us are not getting the screenings. A couple more facts and figures. Specifically, I want to call out the second one here, that on average, our risk is about 1 in 20. So, I know people, okay, 1 in 20, oh yeah, it's pretty good odds. That's true, it's true. But if you think about your group of friends or your neighborhood, that type of thing, if you say, oh, okay, the 20 of us here, that means 1 in the 20 of us are going to have colon cancer in our lifetime, colorectal cancer, which is colon cancer and rectal cancer. So in looking at it in that light, it actually is a large number. 90% of people are 50 or older when they find the diagnosis of colon cancer, but unfortunately the numbers under 50 are gaining every single year. They're growing 1 to 3%. So we'll talk a little bit more about switching this age to 45 for screening. Those of us that have a first degree relative, so parent, sibling, or offspring, parent, sibling, children who have colon cancer are 2 to 3 times the risk of developing colon cancer. And then so the young onset colorectal cancer is on the rise, which is so disconcerting. But rates are actually dropping for our older population for colon cancer, and they are rising for the younger population, so under 50 years old. And the other piece is ethnicity. So significant increased risk in African American or in Blacks. They have higher incidence and higher mortality rates. So the rates are 20% higher for that population, and the death rate is about 40% higher. A lot of this is due to the late onset of diagnosis. So again, really, really hammering home the importance of screening. And screening at earlier ages, even depending on your risk, which oftentimes then is an earlier age with African American or background. So the effects of colorectal cancer on the body. So I bring this up and I've put these stars on here for what are the most common presenting symptoms for people. So pain in the abdomen, blood, either in the stool that you see or having black or bloody stools. Or the next most common after these ones is iron deficiency. So we do routine blood work. People have no symptoms, but we're doing routine blood work and see that their iron levels or their blood counts have dropped. Later onset stages, people have more weight loss or problems with going to the bathroom from a larger mass. So I won't go through all of the medical school diagrams, but this I like this diagram because it shows people what we see when we're talking about colon cancer and the stages and how significant it is to find it early rather than later. So if you look up here on this graphic, stage 0, so you can see that there's the polyp that's growing. And in this polyp, there's not a cancer per se, but it's stage 0, like it looks, this is a precancerous lesion. What happens is if cells have gone abnormal and started to divide more rapidly, started to reproduce themselves, divide more rapidly, then we see this polyp form. When cells are doing that, dividing more rapidly, it's very common then, or it's more common to be appropriate, it's more common that one of those cells can then turn rogue, be abnormal, and turn into a cancerous lesion. So then that's this stage 1 here. So within the polyp, there's cancer. If we are to remove that polyp, we are removing the cancer. So the importance of this graphic, stage 0, we can remove this and then that polyp will not become a problem for the person. That polyp will no longer be part of their body. It will be taken off, removed. Same with stage 1, we can remove it. Of course, more workup needs to be done quite often to make certain that there is no spreading or that it hasn't gone any deeper, but it can't be removed at this stage. Stage 2, now you can see that that cancerous lesion has gone deeper, and the concern is that it would spread. Stage 4, it's gone through the wall of the colon, and sometimes these can even grow on the outside of the wall of the colon. And then stage 4 is when it's spread to lymph nodes and to other parts of the body, most commonly the liver, which is where it goes when it leaves the colon. So again, to hammer home the point, if we get it early enough, we can remove it, and then that cancer does not become a problem for the person, as opposed to if we're getting it at the later stages here, where treatment is much more significant. There's surgery, there's chemotherapy, there's other treatments that come about. And I guess at this, I should also say, today we're not getting into the nitty-gritty as far as all the treatments. There's been a lot of progression as far as treatment of colon cancer. Sometimes people will have spread to the liver and then the cancer can be removed, like cut out of the liver. So there are a lot of progressions as far as treatments, but we're not focusing on the treatment side of colon cancer today. Okay, so this is our anatomy lesson. So just to put it in perspective, so we're looking at a person as if they're standing in front of us, and the head is, at the top of the screen. Of course, you see the belly button here. So this is the person's right side of their body. This is the left side of the body, for those of you that want that detail. So in the middle here, what's not pictured is the small bowel. So the small bowel sits in here. When food comes in the body, okay, that comes down the esophagus and it goes into the stomach, which is right at the top here. And the stomach's just a holding tank for that food. Okay, then it goes into the small bowel, which usually floats all in the middle of this large bowel, large intestine. So when it's floating here, the purpose of the small bowel is to absorb the nutrients from our food. So when food is going through the small bowel, it's in liquid form. And again, the small bowel, the big thing is that it's absorbing all the nutrients, okay? Then this liquid food, which is going to become stool, is dropped in here to the cecum. And this little tail off the cecum, this is the appendix, which humans don't need, as many know, since their appendix has been removed. So it gets dropped into the cecum. At this point, that is still very liquid. The big purpose of the large bowel or large intestine is to reabsorb the water, because your body needs to hold on to the water that it has. So the big purpose to reabsorb that water, and in turn, that will make the stool more solid. So up through this ascending colon, then you're going to have more liquefied stool still all through the transverse. When it gets over here to the descending colon and sigmoid colon, it's a lot more solid, like almost like what you would see be excreted from the body. I say that because a lot of people, they'll describe having like a gurgly stomach, specifically on the right side. That's correct. We have liquid there, and as liquid is getting pushed through, it causes gurgles. On this left side, a lot of people describe almost having a hard, like if people are suffering from chronic constipation, they can describe having a hard lump on that side of their abdomen, and like it can cause pain for them. It's bothersome. After they have a bowel movement, they don't feel that lump anymore. That's because on this side, the stool is much harder. So I say that because what's interesting is when we look at colon cancer, the ascending colon on this side, where it's still more liquefied stool, the cancers that come up on this side are more likely to bleed, to show up as bleeding. And then on this side, there can be polyps on either side, but really the blood ones show up more on this side, polyps a bit more on this side. This is a picture of a colonoscopy with colon cancer here. So normally when you're looking at this black, the dark part in the middle, that's just the actual colon. So it looks like a hole, like a cave almost when you're going in with the scope. And then this is a cancer that's growing off the wall of the colon. So here they would try to remove it. They would not likely be able to get the entire cancer, but at least a majority of they could get it and then, okay, move forward with next treatments. So risks for colorectal cancer. What a boring slide, huh? Older age, African-American race. If you've had a history of colorectal cancer or polyps, depending on the type of polyp, it really can put you at increased risk. That's why it's so important when a polyp is removed that it's sent to pathology so we can identify what type of polyp it is. If you've had a colonoscopy and you've had a polyp removed, we absolutely must find out from that gastroenterologist, the doctor that did the procedure, when your next colonoscopy will be. Because depending on the pathology report, that your next colonoscopy or colon cancer screening, you might be good for 10 years, which is the standard if it's normal, or it might be 5 years or 3 years, or even just 6 months. So it's really critical to find out what is growing and what type of polyp that is. Inflammatory intestinal conditions, so like inflammatory bowel disease, like Crohn's or ulcerative colitis. Inherited syndromes. So there are some inherited syndromes where people can have a huge number of polyps in the colon that can increase their risk. Family history of colon cancers we discussed, and then these are the ones that we have control over. So a low fiber, high fat diet is a risk for colon cancer. A sedentary lifestyle. Having diabetes is a risk. People that have diabetes or even just insulin resistance. So pre-diabetes or insulin resistance before pre-diabetes is even diagnosed, that increases a person's risk for colon cancer. Obesity has an increased risk for colon cancer and an increased risk of dying from colon cancer compared to counterparts that are in the normal weight range. Excuse me. Smoking, alcohol use, and radiation therapy, history of radiation therapy for cancer. Okay, so let's focus on how we can lower our risk for colorectal cancer. Excuse me. So this for number one here, it says get screened for colorectal cancer. To be totally appropriate, and I'm sure Jay will appreciate this comment, okay, getting screened for colorectal cancer is great because we could find something early. It does not lower someone's risk for getting colorectal cancer. So that's really my error that I put it in here. But it lowers your risk of a bad outcome and we can do something earlier, but actually doing the screening doesn't lower your risk of getting it. So the next one's, not to be repetitive, but just really quick, eating lots of good quality foods, regular exercise, taking control of your weight, not smoking, and avoidance of alcohol. So we'll go into those in detail. getting screened for colorectal cancer. So this, it's before someone has signs or symptoms. I can't tell you how often here in the office that I see someone and we talk about colon cancer screening and they say, but I don't need it. I don't have any symptoms. I don't know why I need to do that. That's exactly the point, right? The screening is before someone has signs or symptoms. If someone already has signs or symptoms, then the medical lingo, we're not screening anymore. Now we're trying to diagnose what that condition is. So specifically screening for colorectal cancers without signs or symptoms. There's been new recommendations out, I want to say about 3 years ago now, 4 years, from American Cancer Society and the United States Preventative Service Task Force that recommends starting screening for colon cancer for anyone at average risk. That means the general population starting at the age 45 instead of 50. The general consensus is, we're seeing the rates go up in the younger population, and it's lifestyle driven. It's because of the standard American diet, is because the average American, we're not as active anymore. There's a lot of sedentary behavior. The average weight has gone up significantly. So these risk factors that lead to colorectal cancer are coming into play. So lifestyle driven, more cancers in the younger population. So how do we screen? There's a number of things that we can do to screen. Here I've summarized the most common ones. So there's the stool test. So that's the FIT test. So FIT Ensure is a common in our area, or the guaiac-based, the fecal occult blood test, which is slightly less accurate than the FIT. For that, then it's done every year. Then there's stool test for DNA, that's every 3 years. CT, colonography, or flexible sigmoidoscopy. So that is, people ask about this a lot because they say, oh, I don't want the colonoscopy. Can I do a CT? You can. So the CT, you have to go through all the prep that someone goes through for a colonoscopy. And most people describe that as the worst part. So you still have to do all the prep. Instead of having the colonoscope go into your body, though, it's not a scope going into the body. There is air because the colon needs to be filled of air when we take a look. And it's still not as accurate because still small polyps or flat polyps could be missed with the CT. But that's been a more common question for people to ask about. So yes, it's available. No, I would not recommend it to the average person because you go through all the process to have a test that's not as accurate as other tests that are available. Flexible sigmoidoscopy. This one used to be more popular. The popularity has waned because it's only showing half the colon. You don't get to the other half of the colon. So then people do, it's a stool test to get to the side of the colon that bleeds, and then you get the sigmoidoscopy to take a look at the side of the colon where you see more polyps. Still not quite as accurate as the colonoscopy. So to walk through these ones, because the screening is so life-saving for people. The stool test, again, that's the FIT test. This is a picture of it. So it's something in this fashion. So stool test, you pretty much put this little paintbrush, you take a little bit of your stool from your home toilet and you put it on here, and then you send this in and they check to see if there is blood in the stool. Most of the time, blood that's in the stool from colon cancer cannot be seen. So you could say, oh, well, it doesn't look like there's blood in there. That's great, but there might be cancer that's leading to bleeding that we just can't see. Downside is we have to do it annually, but after 3 consecutive years, then this has really good sensitivity for a test. If this test comes back positive, a colonoscopy will be recommended because then we need to diagnose what is in there that's bleeding. Cologuard, so this is, a lot of people have asked about this after they see the commercials of this little box. It's good because it's gotten more people to do the screening. It's not one that we really highly recommend typically because there are more false positives with this test. So it's a stool DNA test. So they test for blood in the stool, but also the DNA that's found in colon cancer. If positive, a colonoscopy will be recommended for this as well. Because there are more false positives and that sometimes they can miss cancers as well. A lot of insurance companies actually don't cover the Cologuard. And then colonoscopy, it's the gold standard. It will always be the gold standard because if someone has a colonoscopy, we can screen for colon cancer, like, hey, let's see if it's there, but we could also take care of it at the time. You know, if there's a little cancer or a little polyp, it can be clipped, removed, person's gotten the treatment right then as well. So it will always be the gold standard for that reason. If it's negative, you're good for any cancer screening for 10 years. If it's negative and you don't have any increased risk factors of family history or previous abnormalities. And it reduces the incidence of cancer by 89%, so really significant. Oh, excuse me. And that's just another picture. It's just pictorial of what a colonoscopy looks like and how they can remove that polyp. And then they actually take the polyp into the colonoscope and they pull it out the other side and they send that to pathology. It's really a neat scope because they can go into that scope and take pieces from the colon and pull out and send off to pathology. I'm going to skip through these because there's way too many words there. Nutrition. So I'm talking a lot here. The nutrition, a number of you all that are on here know about nutrition. So I just want to call out that, yes, I know I'm saying what I've said multiple times before. Jay and I had talked about this and we've gotten feedback that people have said, okay, yes, I know it, and it's still helpful to hear it again. So for those of you that want to hear it, great. Those of you that are sick of hearing the same thing, then you can tune out right now. I wouldn't recommend it because this is such an important piece. And then at the end of the talk, we're actually going to talk about motivation because a lot of us know what to do, but there's a disconnect between knowing what to do and what we do. So how do we fill that? How do we actually translate knowing what to do into making those good decisions that will amplify and optimize our health? Okay, so to minimize our risk of colon cancer, eat more vegetables, fruits, legumes, which are beans, lentils, and peas, and whole grains. In eating less processed meat and red meats in particular, but also all meats. So that's white meat and fish as well, and dairy and processed foods, which are very low in fiber if there's any at all. I put this in here because I feel like we need to shout this from the rooftops. So the meats, so processed meats and red meats, these aren't ones that, oh yeah, maybe I'll have them once in a while. Oh yeah, let's make sure, we'll get hot dogs for the kids at the barbecue. Okay, these are known to cause cancer. There's no question as far as these processed meats. So sausages, hot dogs, bacon, salami, ham, processed meats cause cancer, period. So it is toxic to humans, it's a carcinogen, it causes cancer in humans. Red meats, so that's beef, pork, and lamb, the four-legged animals, they probably cause cancer. So processed meats, to say it differently, it's a class 1 carcinogen is how we refer to it. That's the correct labeling. Whereas the red meat's a class 2A carcinogen, probably cause cancer in humans. More studies need to be done until they can conclusively say that. I put this in here because this is the kind of information that I find to be really interesting when it comes out to the public. Okay, so red meat risk. So we know it causes these meats are not healthful, right? So red meat risk, in context, 21% of bowel cancers are caused by processed or red meat. Okay, 1 in 5 people that get diagnosed with colon cancer would not have it if they didn't have processed or red meat. To me, that's a huge number, but they put this in context because they want to make sure that people are not too concerned about it. So they say, oh, okay, well, but compared to lung cancer, like tobacco really causes a lot of lung cancer. So processed and red meat is not that bad. But again, 1 out of every 5 people with colorectal cancer would not ever even have it if they did not eat processed or red meat. So how do we lower risk? Next step is controlling our environment. So a lot of times, very frankly, a lot of times what we're dealing with nowadays is actually, it even falls into the category of addiction to food. Processed foods are a highly addictive substance, and people's response to them that, oh, I can't stop eating it, oh, I keep having cravings for it, their responses of addiction. So I find it easier for a lot of patients that are wanting to change their lifestyle or lose weight or whatever their motivation is, to just call it for what it is. So when we're dealing with any addiction, we need, especially important to control what comes into our home or the places where we live, work, spend our time, to control what comes into those places when we have control, or somehow else to control our environment so that it's not sitting there staring us in the face, right? To have things ready to eat. So really food prepping, right? If we have all this healthy food in the fridge, but it's going to take us 30 minutes to make a healthy snack, that's not very enticing when we're hungry. How do we do it so we have it cut up, ready, so we can open our fridge and like, wow, I have these great options to pull from and I can eat it right now when I'm hungry. And when eating out, having good options picked out ahead of time, right? So a lot of people want to eat out. Finally, more and more people are getting out, but really like perusing the menu online and knowing what you're going to order before you get there. I think Weight Watchers is probably the biggest promoter of that. So you're not sitting there like right in the middle of conversation with friends trying to figure out if you're going to be good or be bad. You know, like really having your plan picked out. Is this going to be a splurge for me today, or do I want to stay on plan? In which case, I know I'm going to eat the quinoa salad or whatever it is. So I put this up here as almost every presentation I do because it's just so impactful to see. So this, I would highly, highly recommend for everyone here to draw your own pie chart of like really draw a chart and write down what you had to eat on any given day. It can be today, it could be yesterday. Yesterday would probably be better since the day's over already. And then plug in, you know, what did you eat? And then what estimated percent is processed animal food, processed plant food. And that includes like the Gardein or Morningstar Farms, those types of things. To be honest, I don't know if it's even fair to call them processed plant foods because they are probably better suited to be just in the processed food category. Definitely Impossible Burger, those kinds of things, they're so highly processed. Then what percent is the whole plant food, which is the disease-fighting, cancer-fighting, full of antioxidant food that's going to lower our risk for colon cancer. So just to do it, just so we can see where each of us are individually. This food-based diet pyramid, I'm sure you guys have seen a version of this before as well, but really this is what our goal is, right? So we want to get tons and tons and tons of fruits and vegetables. Why? These are the foods that are high in fiber. So being high in fiber, we're feeding our good gut bacteria, right? So we're getting our good gut bacteria fed, and then they can produce the slime that stays on the walls of the colon that helps protect the colon in that fashion. Less protection for cancer, more protection for leaky gut syndrome and other issues, symptoms. But it's feeding the gut bacteria. That fiber is also helping push things through the gut faster. Helpful on multiple levels. Probably most notably is that there's a lot of toxins in our food nowadays that some we have control over, some we don't, you know. So if there's pesticides, for instance, or how about if it's organic, but the farm just happens to sit next to a busy road where you're getting all the runoff from the cars, anything, you know, some of that cannot be washed off if it's going to come into our body. And then of course, all the junk that comes in with processed food. And if that comes into our body, if we have a lot of fiber pushing things through the colon quickly, all of that is not going to have the ability to sit there and get absorbed into your body as quickly. This is theory, but widely known in the medical community that, okay, if you can push it through quicker, then it won't be absorbed as quickly. Ideally, not absorbed at all when it's those compounds that we don't want in our body. And then whole grains, Whole grains, absolutely wonderful. That one thing that irks me about this picture is that this macaroni does not look like whole grain, but really whole grain, or even good options now with chickpea or lentil pastas, things that are pretty easy and quick to make, but are much more helpful options than just like old school spaghetti or that type of thing. Okay, so again, just knowing, having our options, controlling our environment. You know, if we pick things from this shelf, we're going to have to deal with it staring at us every time we open the cabinet at home, you know? So if we can leave it at the store with the one time we walk down the aisle, then we don't have to fight with ourselves the 6 or 7 or 8 times we see it in our cupboard at home. So the more we can really choose these kinds of foods, so when you get home, you see this big colorful fridge, colorful kitchen, ideally with chopped up, ready to eat, some of it at least. So we have good, healthful snacks. Okay, so protective foods, we know those already. Added spices, Jay's talk, this is, if you all are interested in the spices, Jay's talk from our disease prevention reversal seminar was fantastic, because it focused a lot on those spices that are herbs and spices. Okay, getting regular exercise. So getting regular exercise is critical, again, for developing colorectal, or for minimizing development of colorectal cancer. That's the same for prostate cancer and breast cancer as well, other cancers too, but specifically those 3 groups: colon, breast, prostate cancer. I put Walk with the Doc over here because it's on Saturday at 9 a.m. So if y'all want to join us, it should be a beautiful day at Ventura Pier. Taking control of our weight. So we'll talk more about that, but at the end, really the knowing your whys and the lack of motivation piece. But being overweight or obese, which 70% of Americans are now overweight, or their weight is in the overweight or obese categories. That increases our risk of getting colon cancer and passing from it. Smoking, I'll run through that because it's not as common nowadays, but really the more you try, the more you're likely to succeed. That goes the same for alcohol. And the important piece here is down here, looking at this, the beer, the wine, the malt liquor, the hard alcohol. Okay, so this is, in medical school, what you learn is that you ask someone if they drink. A lot of times they'll say, no, I don't, I just have beers. You know, it's for some reason, a lot of people do not consider beer or wine even alcohol. Your body, it's all the same. So if it's alcohol that comes from beer, from wine, from malt liquor, from hard alcohol, it doesn't matter. So a lot of people, I don't know why this is so widespread in our society, but they'll change from hard alcohol to beer or wine, thinking that is better for the body. Now, alcohol is alcohol. It's going to wipe out your bacteria, because that's what it does, like hand sanitizer, alcohol, right? Your good bacteria, and it is toxic to the human body. It is a poison. So it's going to cause the cells to be damaged and the DNA to be damaged. So the more we can avoid it, the better. Okay. Then this piece, and then I'll stop talking for a minute. And I asked Jay to help me a little bit with the motivation piece, because she does such a fantastic job. The piece here is that more than 80% of Americans, when asked, more than 75% of Americans say that they eat healthy. But when we actually looked at when data was looked at, more than 80% of Americans did not even have the recommended amount of fruits and vegetables a day, which if you're not having enough fruits and vegetables, by far and away, please, that's the best thing we can do. First line to get that up, because it's so full of antioxidants and good fiber. Antioxidants, they are helpful to help minimize damage, minimize cancerous cells. They have a lot of different functions, but to help on that aside. Okay, lack of motivation. So again, from patient after patient after patient, I hear quite often, okay, we know what to do. I know what to eat, but I just don't do it, right? I mean, we're all human. We have some of this at some point, every single one of us, but how do we counteract it? So what I recommend to patients is a fewfold. the first is, especially nowadays, please, 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 if you have any depression, anxiety, any mental health concerns even, please talk with your provider about it. A lot of times it shows up as lack of motivation to do things, or a bit of irritability, just indifference. It shows up like that. So it's not always this picture of someone coming in like where they can't stop crying all the time, or, it's not that. Like a lot of depression, anxiety, other mental health is not addressed. And if it's not addressed, a lot of times then it negatively affects physical health, not just from that condition, but then we're making choices that additionally negatively affect that person's health. So please get help. If there's even a concern for it, it's good to have a conversation around it. The second is to really get real about the current state. So we're really good at sugarcoating and making ourselves feel better. So if really getting real. So this exercise, it's not fun for people to go through. I definitely don't recommend you do it right now. But to sit down and for at least 5 or 10 minutes, much longer for some people, be very serious with yourself, be honest. I mean, you can even if you see doctors for conditions, look at the list of diagnoses that you have, and be clear about, okay, well, how do I look on paper? Like, is that helpful? We need to know what is my current state of health really, and what is the probable future for that current state of health. If someone has, if they have obesity and high sugars like diabetes, high blood pressure, high cholesterol, you're at high risk for a heart attack or stroke. I mean, yes, it'd be nice to be gentle about it, but that's the truth. We're high risk for heart attack or stroke, or like high risk for fatty liver, for, end organ damage from these conditions. And usually at that point, there's multiple organs that are already showing stressors from it. So again, getting very, very clear about it. And that includes, if someone's dealing with fatty liver, as an example, person to person, but really look at what end stage liver disease looks like. Think about what your life would be like if you have that end stage liver disease, or after having a heart attack, after having a stroke. But get really clear about what that future looks like, and also get clear about if there's any food addiction. Sometimes we need specialized care for food addiction. Sometimes it's more of addressing it, and I'm happy to address it with you. There are other lifestyle medicine doctors, and for food addiction, obesity medicine specialists, especially, might be another one to look out for too, or to seek out. But really get real about the situation. Okay, and then that's the doomsday, and then to identify your why, because that's what's going to pull us through during the hard times. In this, Jay, are you able to jump in?
I'm here.
Okay. Do you want to jump in and kind of make it sunshiny after my doomsday?
So I think what people don't realize about motivation is that it is not something that you can rely on. It's not something that, I have to be, I have to push and muscle my way through it. No. So the way that it really works is you find reasons. You find reasons to do this for you. What are your reasons? And, a lot of people are like, well, my sister's coming to visit in a couple months. I'd like to be thinner than her. I want to fit into those jeans that I really like that I don't fit in. Okay, those whys are great. Those whys are fine. But if you can evoke a very powerful why, like what Dr. Cox was just talking about in terms of, okay, I know that I don't want to go back there, wherever there is for you. I know that I've seen family members, for me personally, I'm going to give you a couple of examples of my personal whys to give you an idea of how deep, how powerful, and how emotionally evocative we want these whys to be. So my aunt had pancreatic cancer. And she was a vibrant, vivacious woman, and, deeply, deeply loved by everyone that knew her. And she died a very painful death from pancreatic cancer. And I saw it happen. That is a powerful why. That is not so sunshiny, but it is certainly a motivator. It absolutely is a motivator. And I saw how her loss, affected everyone else in my family, everyone else that I care about. So how are the people in your life going to be impacted by seeing you suffer, by you not being here anymore? That's a huge, powerful why. Another one is my personal story. If you've not heard it before, I was diagnosed with stroke level blood pressure about 10 years ago now, all cured. But at the time, my father-in-law had just had just passed away actually from a massive stroke. And I saw exactly what that could look like. And I knew that's not what I wanted for me. And it certainly wasn't what I wanted for my husband, with those genes, right? And so it was really important to us that we pay attention to those factors that could contribute to that. Now, what you're seeing here over and over and over again in all of these things is eat lots of things that contain fiber. Don't eat so much of the rest of it. I mean, it's quite simple, if not easy, but let me tell you, one of the best motivators, and this is what I'm talking about. So establish your whys, your powerful whys that make you go every single time you think about them, whys that impact you personally, but also impact those people that you care about. So powerful whys that really, dig deep into your emotion and into your mental state. Really powerful whys. Then start doing it. Once you have that little fire under your backside of that motivation, once you start doing this, you start feeling better. Let me tell you, I see it over and over and over and over and over again. Once people start to make significant changes, they're like, oh my gosh, why didn't I do this sooner? It's not do I have to keep doing this? That is less often does that happen. Mostly it's like, what else can I do? What else can I do? This feels amazing. And that is what keeps us going. Realize that there are lots of reasons we might lose motivation or that we might feel no motivation in the beginning, including these addictive foods that hijack our brains and can including marketing, including, you're no fun if you don't eat junk food, including all of those things, those kind of social development kind of things, this kind of programming kind of stuff. So realize that there are things in the way, but you can get past them if you are aware. So find some reasons, some powerful reasons, things that create visualizations for you, and then start doing it. Start to see your numbers improve, start to feel better, start to get off of the sofa without going, oh, like that, right? Start to feel less pain in your body, feel less fog in your brain, feel more energy and vitality. Realize that your quality of life is way more important than that salty, sweet, whatever snack. It's way more important than that. People say, well, I will be miserable if I don't eat those things. Trust me, you won't. As soon as you get those out of your system, you will be much happier and much more at peace with your body. And so find those powerful whys and then just start, stay motivated, and keep your support system in place.
Thanks, Jay. Thanks. And I usually also recommend, like, as far as why, when you're doing actually sitting down and writing out your why, there's a saying, and you've probably come across this and taught to this, Jay, that you kind of, usually it's 6 or 7 layers deep, right? Because I want to look good for my vacation. And then, well, why do you want to? Because I want to feel better about myself. Well, why do you want to feel better about myself? Because, like really getting to the deep whys. And then the last piece here, I'll make the healthy choice the easy choice. Yes, let's make it easy on ourselves, right? So this, actually, I'll skip over this, but just a quick nod to it. This is a cool survey to go through. It's called the 4leafprogram.com. You can go on there, you can utilize it for free as an individual, but printing it off and actually going through it so you can see your number. And then doing it again, and then doing it again. It's always good to have some feedback. So I tell patients, the way I know that you're getting better is because when I ask you how many servings of vegetables, fruits, legumes, whole grains you're having, the numbers are going up, and then, meats, dairy, processed food, those numbers are going down. So this is a way to do it on your own. And again, it's available to you. So 4leafprogram.com, really cool, just quick little survey. So we are at question answer. We're pretty far as far as time goes. So I'm going to pick up this question that came in. Someone is obese, has high blood pressure, diabetes, and high cholesterol today. By changing one's diet, can you preserve the reverse the conditions and bring health to the organs? Can you bring health? Absolutely. Can you reverse the conditions totally? Some people can, sometimes it cannot be done as much. Specifically, the longer, diabetes in particular, 92% prevent, reverse with lifestyle change, right? So the longer someone's had diabetes, the harder it is to reverse out of it, even if we go like really hardcore on all the lifestyle changes. Just because it is possible to do so much damage to the organs that even if we stop doing damage, that organ function will not come back. So the same, fatty liver again is a good example, because the liver can tolerate so much, and then once it can't tolerate it anymore, once it's scarred down and part of it's become cirrhosis, that has scarred. It will not go back to normal function anymore. So yes, there's a whole lot that we can do, but it really depends on the individual, how long it's been going on, how significant it is, if we can totally reverse out of the conditions and bring full health to their organs. But really, by far and away, the huge majority, we can do big reversals and improvements.
Yes, absolutely. It's about moving toward better health, not about trying to achieve perfection, but just getting better than where you are. And of course, we all know this, that prevention is everything. We tend to, speaking of motivation, we tend to wait until things have gone wrong, but the best time to start changing your habits was yesterday. The second best time is right now, right? Okay, a couple more questions. Where does low-fat hummus fit on the food pyramid?
That's awesome. So thanks for asking that. So low-fat hummus, so usually it's made from beans, right? So chickpeas or garbanzos. So most commonly, but white beans, black beans, any kind of beans. So that falls under the legume area. So it's a bean equivalent. So oftentimes I'll teach to at least 1 or 1.5 cups of legumes a day. That's one of the Blue Zones teachings. So hummus falls into that. Tofu also falls into that, since it's mashed up soybeans.
Absolutely. If you can find oil-free hummus that is made with tahini, just ground up sesame seeds, then that is a whole food, just a bunch of whole foods all ground up, and that's absolutely glorious. Okay, another question. Do we need a doctor referral for all of the tests, or is there ones we can get over the counter?
Yeah, that's a good one. So for the test for colon cancer screening, so I don't know the answer. So I know that there's home tests for blood in the stool, but I do not know if they're as accurate as like the Fit and Sure per se. More and more, a lot of groups of docs are going to where it's just a standing order. If someone wants cancer screening, by all means, get the cancer screening, please. So, and then it's just more routinely done where someone can show up to the lab or, and just have it on routine where you're not needing an order. The colonoscopy, of course, is an exception. Cologuard, that's the one every 3 years that has more false positives. They do require a doctor order. So it's like the stool test is the one that you may be able to get over the counter. I just don't know if the sensitivity is the same as what we order.
So just a clarification here, somebody said, so is fatty liver not reversible? And that's not correct. Do you want to elaborate on that?
Oh yeah, thanks. So sorry. So fatty liver, there's a spectrum on that. So actually, as the same with other lifestyle diseases. So in the early stages, it's totally reversible. Totally reversible. In fact, they can see total reversing in 10 days. So just stop doing the damage and it's better. So, but once it gets to the point where there's scarring, which it depends, everyone's a little bit different, depends on genetics, a bunch of other things, but typically that takes many years for that scarring to happen. But once it's happened and that scar tissue, kind of like a scar, I have a scar in my hand here, you can't see, but it's when the scar heals, it contracts, right? If you like ever skinned your knee, when that heals, it contracts, that scarring will never go away. So it just depends on what level. So yes, it is quite often totally reversible, but in the late stages, we can make it better, but we can't conclusively say that it's going to go back to normal.
As an encouragement, we share a client patient who is very happy to share her story, so it's okay that we share it. She was a stage 3 and went down to stage 0, and she is doing fantastically. And she had other stuff going on as well, serious stuff. And so it's definitely possible. And really, you know, any move you can make toward better health, your life is going to be better. Your quality of life is going to be better. And that's really all we want for you. We want what you have now to become better. We want you to have a more vital, more vibrant, more beautiful, pain-free if possible, suffering-free life. That's what we want for you.
Mm-hmm. And suffering-free as in not opening up the cabinet and seeing the chips 10 times. That's painful for people. Then they're coming to a place of like loss, right? So, but if instead you can open up and say, wow, look at all these great snacks, that's a lot less, that's not suffering, that's just living fully. So I know I keep going back to it, but it's so often, I mean, multiple times a day, it's like, oh gosh, that's so painful. Let's stop causing pain, and let's get you, you know, if your journey is onto health, let's do it.
Speaking of not suffering, food that is healthy can also be decadent and fun and delicious and all of those things that you want. That's my favorite thing to do. I love food, but my diet is almost exclusively whole plant foods, like very, very nearly that 100% mark, because it's important to me for it to be that way. But it's also fun. It's absolutely fun and delicious. So if you need help with that, reach out. We have lots of recipes and lots of ways you can get that done.
Yes. Well, thank you all for joining us. So if you have any other questions, by all means, as always, reach out to us. Show up to Walk with a Doc, show up to Plant Chat. You don't even have to walk with us. Some people come and ask questions and then leave. So whatever works. So have a wonderful Wednesday.
Have a great day, everyone.